Hi everyone, my name's Marianne and I'm one of the women's sexual and reproductive health nurses that works at Bendigo Community Health Services. And today I'm just bringing you a little video to talk about all the different types of contraceptions that are out there. We're going to talk about how effective they are and how they work. And we're going to start with the least effective and then move our way through. And I just want to highlight that when I'm talking about the effectiveness, the rates that I'm quoting are actually what is called the typical use rates. So if people were to use the forms of contraception 100% accurately all the time, the rates would be higher. But these rates are actually what Family Planning Victoria provides as a typical use. So they take into effect that we're human beings and we forget things sometimes. So if I'm saying that something is 76% effective, what that means in reality is that out of every 100 women that use that form of contraception as a contraception, then 24 of those 100 would get pregnant in a 12-month period of time. So that's what the typical effectiveness rate means. Okay. And it's often quite different than what we think it is. So the first one we're going to talk about is fertility awareness. So some women choose not to use any form of contraception and they use fertility awareness, which means basically avoiding sex during a time when they're most fertile. So they either don't have sex during that time or they use another form of contraception during that period of time. It does require a woman to be very aware of her cycle and to notice the changes that occur during a cycle. So it's about 76% effective. And obviously it can be tricky sometimes if, for some reason, stress or whatever else, their cycle changes 1 month. So that can be tricky. The next method is the withdrawal method. Now we hear a lot about the withdrawal method in our clinic. A lot of young people use that method. And so basically what the withdrawal method is just what it sounds like, is a guy withdraws, pulls his penis out of the vagina before he ejaculates or comes. And this method is typically 78% effective, which is quite, most people are quite alarmed when you tell them that. And that's because a third of guys have sperm in what's called their pre-cum. So a guy can release a small amount of semen before they get that feeling that they're going to come, and in that semen is sperm. So you can see why the effectiveness is much lower than people think it would be for that reason. All right, moving on to condoms. So there's two different types of condoms that are available. This is the female condom. If you show this to a guy, they'd be quite alarmed because they'd be worried about how they were going to fill that. It's not very common, the female condom, but it is something that women can buy. And what you do is you pop it in your vagina before you have sex. And the idea is that it covers the cervix, so it stops any sperm from travelling up into the uterus to meet the egg. They're not easy to buy, so that's the tricky thing about the female condoms. Not all chemists stock them. Often women have to get them online, and they cost about $9 for 3. So yeah, it's about $3 each. And they're 79% effective as a form of contraception. So then we're going to have a little look at the male condom. Don't need to take that out, I'm sure you all know the male condom. So the male condom is 82% effective, so for typical use. Obviously it's much higher if it's used accurately 100% of the time, but because it could break, it could slip off, it mightn't have been put on properly in the first place, so some sperm sneak in. So yeah, it's 82% effective. So that means 18 women out of every 100 using the condom as a form of contraception get pregnant in a year. So, you know, most of us probably remember the episode about Rachel and Ross. That's how their baby was created, by the condom. All right, and then we're going to talk about the diaphragm, so the female diaphragm. Again, this is another one that's not used very often now. It used to get used a lot years ago. Maybe our mums or aunties or whatever used to use it. You can still buy them though. So basically, or some people call them the cap. So you pop it in the vagina and it sits over the cervix. So again, it's to cover the cervix to stop sperm from getting through. You have to use like a gel with it every time that you use it as well. And again, these aren't easy to buy, and also, you know, they only come in a few sizes as well, so they don't always fit well. So it's about 88% effective. All right, let's move on to the pills. So there's different types of pills. So there's one pill that's called a progesterone only pill. And it's not prescribed as often as the combined pill, but the progesterone only pill it could often be prescribed to women after they've had a baby if they're planning to breastfeed, because it doesn't interfere with the production of breast milk in the early stages. And it works by changing the mucus. So you still can ovulate, but it changes the mucus in the vagina and helps prevent the sperm from travelling up and meeting an egg. So some women might also be prescribed the progesterone only pill because for some reason, some medical reason, they can't take estrogen, and so therefore the doctor could prescribe them the progesterone only pill. It's typically 91% effective. And the thing that's really hard about the progesterone only pill is that it only has a 3-hour window where you have to take it at the same time every day within 3 hours. So that can be really hard because, you know, if you're busy, and especially if you've got a little baby at home or whatever, it's easy for that time to go by, and before you know it, you've missed it, and you could get pregnant. Okay, so then we're going to talk about the combined pill. So we call this the combined oral contraceptive pill. Or most people, when they talk about the pill, this is usually what they're talking about. So basically it's where you take a tablet every day, all the time, and these pills, the idea is they stop you from ovulating every month. They're typically 91% effective, and you know, that factors in the, you know, the missed pills here or there. But you do have a 24-hour window period to take these tablets, so there's much more flexibility with these compared to the other ones that I was talking about before. They're pretty cheap, so the common brands that are regularly prescribed are only about $14, and you get 4 months worth of tablets as well. So that's really good. All right, so next we're going to have a look at the vaginal ring. So that's this little baby here. Not many people, it's not a very commonly used device, but it's a little device that basically, you know, squeezes in like this, like those little pop-up tents. Pop it in your vagina, and then it opens up, and it can either sits flat against the vaginal wall or around the cervix. And it also stops you from ovulating. You put it in your vagina and leave it there for 3 weeks, and then you have to take it out after the 3 weeks, and then you have a bleed, and then at 4 weeks you have to put a new one in. So they're not cheap. They're about $40 each to buy, and you've got to be good at remembering, you know, when you've got to take it out and when you've got to put a new one in. And it's about 91% effective as well, typically. Yeah. Okay. So then the next option is an injection. So you can have an injection every 12 weeks. And so basically it's just an injection you can get in your arm. Some women get them in their butt, but most prefer it in their arm. And every 12 weeks you have an injection, and it stops you from ovulating as well. It's typically 94% effective. And that's because often women are late and forget to come in and get the second, or the next injection. But if it's used religiously all the time at 12 weeks, then it's 99.8% effective. So it's actually really high. It's kind of the inconvenience of having to remember to come in at 12 weeks that makes its effectiveness drop down. Because it's easy to go, I forgot I was due today to have it. I might come in on Friday, or I haven't got any money to get my script filled, and before you know it, the time goes by and it's past its effectiveness. So that's why it drops down to 94%.